Imtiaz Kamal is a midwife who's in her 80s. Operating out of a small office in Karachi for the past 55 years, she's been campaigning to try and bring down Pakistan's staggering maternal mortality rate by training competent midwives.
Midwifery is my profession, also my passion. I realized that mothers were dying after giving life. They gave their life to give life to a child, and I tried to find out why, and then I realized that almost 90% of the deliveries were being conducted by dais who were illiterate, who had no training at all.
In the recently conducted Pakistan Demographic Health Survey, findings reveal that over 20% of all female deaths in Pakistan are related to childbirth, making it the biggest killer of women in this country.
That's the sad thing about maternal death, that they are preventable deaths. You see, a large number of them are preventable, yes.
One of the indicators that we use as to how well a society or a nation is doing regarding health is the infant mortality rate and maternal mortality rate. Unfortunately, Pakistan is one of the countries with one of the highest maternal mortality rates. One of the main causes is postpartum hemorrhage or hemorrhage related to pregnancy. Third cause that is coming up is iatrogenic, which is actually people, women or their families taking these very seriously ill women to health facilities and them not actually getting the proper health care.
Much has been done in Pakistan to bring down the maternal mortality rate, but most efforts have remained largely unsuccessful. Imtiaz Kamal is convinced that the only way forward now is to have competent midwives replacing the dais.
In Europe, in England, they have midwives with degrees, with diplomas, and 80% of the babies come with nature's help. The midwife is there to support the woman and to make sure things are normal. When everything is normal, you do not need a doctor.
In the UK, normal deliveries are the kingdom of the midwife, and doctors are only summoned if a woman can't deliver naturally. But in Pakistan, midwives don't seem to command the same kind of respect because a lot of people don't recognize that a midwife is a trained specialist.
Yes, there is confusion here because, if you translate the word midwife into Urdu, it is like a dai. Except that, in modern terms, the midwife is really like a doctor now. They go through something like 4 years of training after becoming nurses. There's a big difference from the midwife of the dark ages, let's say, and the midwife who practices today. However, our dai or traditional birth attendant has not progressed. She is where she was hundreds and hundreds years back.
Beginning in 1978, much of the global health community went astray by pouring resources into the training of dais as opposed to midwives. In Pakistan, 60,000 dais were trained, but the scheme didn't really pay off.
Well, that is the famous dai training program. Dai training program is rubbish. You cannot train a dai because dais are not scientifically trained. They will have this dai kit and they will make it pandan, or they will put their jewelry in it. More than 90% dais are not, I will say, suitable.
In the absence of skilled birth attendants such as doctors and midwives who tend to practice in hospitals, home births remain the stronghold of the dai.
Our culture is such that women would not like to come to a health facility to deliver. She would rather deliver at home.
So to clamp down on unsafe home deliveries, the government is attempting to mobilize skilled healthcare providers such as lady health visitors and community midwives to go to the patients rather than waiting for them to come to the hospital. Shehnaz Zaman is one of only a handful of lady health visitors in Karachi to have taken the initiative to set up her own birthing station.
मैंने ये खुद सोचा कि मैं अपना एक सेटअप बनाऊं। टीबीएस से ये लोग करवाते हैं डिलीवरीज, लेकिन मैंने जब यहाँ सर्वे किया तो इतने मैंने ख़राब केसेस देखे कि वो खुद हमें कहते थे कि हमें बहुत खुशी हुई है ये जान के कि आपने मतलब बाकायदा ट्रेनिंग करके हमारे इलाके में आई हैं, तो हम आपके पास ज़रूर आएंगे।
But there comes a point in many deliveries when even midwives don't know what to do. These patients need to be rushed to doctors qualified to perform emergency C-section. But after the break, we look into 3 reasons that often stop patients from reaching the hospital until it's too late.